Good afternoon, everybody. This is Folly Schenk, Cross Health CEO, and I'd like to give you an update on what's happening in the disruptive forces in technology and what this could all mean for you as a company. The original was planned for the 30th of March, as you can see here, but there was a little bit of, let's say, typical disruption in Belgium happening. So I had a big traffic jam, as a result of which we had to postpone this. So apologies for that, and thanks for being with us. What I would like to do is take you through three areas. The first is like what's really happening in this space, what are key trends. Secondly, what does this mean for you potentially in pharma? So what's happening today and how could this involve your organization going forward, and what are companies already doing in this space? And then thirdly, a little bit about the healthcare disruption tour, what we've experienced there, and what we plan to do this year. So three topics, lots of slides, but I think we'll be able to cover it in 45 minutes. You can ask questions if you want, which I will address at the end. So there's a tab called Questions from the Audience. Feel free to use that. So here we are. It's A Tale of Two Cities by Charles Dickens. It's a heavy book, which a lot of people have not read, but I think it's really applicable to this situation. As Peter Hinson, my colleague, says, he says, well, there's actually, this whole space is about the best of times and also the worst of times. There's quite a few trends that really improve outcomes and health. But then again, there's also a lot of things that are threatening people and people's quality of life, etc. as well. So this is really where we are. And this situation, I think you all know, this is, let's say, how Facebook and other digital tools are embedded within our daily life. And this really has led to what we call the VUCA world, which means volatile, uncertain, complex, and ambiguous. So that's really the times that we're living in today, the best and worst of times. And there's plenty of trends happening there, like the sharing economy, not so much I think in healthcare yet, but in other industries like cars, etc., and housing and things like that. It's really big. Artificial intelligence, that's the new kid on the block. We'll cover that as well. The Internet of Things, that's also, I think, a very important one, going way beyond content sharing and websites and things like that. It's really connecting things with each other. And of course, the blockchain trends, which are, let's say, early days in healthcare and pharma, have had quite a big of a hype and then, let's say, a fallback, but I'm sure also that will have an impact in life sciences. So it's all about disruption. And in other industries, we've already seen that. So this is, I think, a beautiful example of what we've seen in the telco industry, where the then CEO of Nokia in 2008 said the iPhone is just a niche product. And of course, by now, the Nokia itself is a niche product, although it has been revived for nostalgia purpose. Another element that really proves that same point is this this chart from The Economist, which shows the evolution of SMS growth over time. As you can see, there's a nice upward and predictable trend up until 2011 or something. And the whole industry was actually looking forward to continuous growth and started to invest or continue to invest in that space. And then disruption happened, coming from the bottom really at zero cost of transaction called WhatsApp, and WhatsApp breached that gap in a couple of years' time and is now the leading player in that space. So nobody saw that coming. Everybody was looking at forecasting SMS growth and investing in a big way, and then down, let's say, something came from down under, in this case not Australia, called WhatsApp. So a lot of industries have seen their, let's say, their fortunes go in a different direction. This is let's say, the evolution of the market caps of the key companies in the world. The green ones are the tech companies, and the other ones are the non-tech companies. Initially, a lot of those leaders were non-tech, as you can see. Microsoft was there since 2001. It was there in 2006 as well. But in 2016, good for them, they stayed as number 3, which is amazing, I think, in this fast evolving space. But the other ones are all, let's say, tech companies. So the most highly valued companies today are tech companies. And also the Nasdaq is back to where it was and exceeds actually the big drop in the early 2000s. So technology is back with a vengeance. And you would believe almost that this is typically a very, let's say, US-centric thing. That's not the case. And this is actually, it's a global trend, but China is doing at least similar efforts in this space. And we've all been hearing in quite recent days about Alibaba and Baidu and Tencent also entering, let's say, Europe and also US with their offerings. So it's not purely a Silicon Valley effort. So that's all great, but is healthcare in any way affected by this? And if so, what should we think of that? Well, when we visited Silicon Valley and New York earlier this year, we visited a company called Startup Health, and Startup Health tries to connect startups with big industries and also is acting like a venture capital company. And they said, well, there's like a couple of trends here that today make this whole situation go for a boom period. And they see globalization as one thing. We've seen the China versus Silicon Valley, let's say, divide, healthcare reform in Europe and in US. A lot of things happening that really are looking for better care at lower costs. Chronic disease, diabetes, heart failure, all of those things, aging, all lead to a higher burden on the healthcare systems. Digital health is showing first signs of let's say, life and actually impact. And then, of course, the golden age of entrepreneurship, where startups are the next big thing and corporate careers are no longer something people should go for. So all of those 5 things combined, according to them and also according to me, are leading to an amazing moment in time for, let's say, healthcare connected, if you wish. So healthcare is connected for the first time ever. The servers are still around there. So the best example of that probably is the electronic health record in the US, but a lot of other devices from different players and stakeholders are actually connected, leading to a potential improvement of care and monitoring and things like that. The cost of genome sequencing has dropped below $1,000 since in 2015 for the first time. It comes from 100 million back in 2001. So precision medicine becomes affordable. Virtual reality is coming to the fore. It's leading to an amazing opportunity for mental care, for other types of disease treatments and support. It's quite new, but it is important. This I found to be a really good example of what this whole technology can do. This is Blue Star from Welldoc. It's FDA approved. It is let's say, a motivational program. It's coaching. It's not medicine, but it's purely coaching. It can only be prescribed. So it's Rx only. You cannot download it and start using it. It's Rx only. And as it's been so effective, it has now, let's say, connected links with most of the glucose meters. So actually the Blue Star program is put inside most of the glucose meters as a support tool for diabetes treatment, and it works. It's been FDA approved, clinical trials and things like that. So these things start to scale. If you look at another component that starts to scale, it's the remote care, remote diagnosis, remote monitoring, where it's expected that we will have 50 million monitoring devices in the homes by 2021. That probably is an underestimation, because I think any mobile phone is actually a device going forward. So this is a huge underestimation. But these are probably companion tools next to the mobile phone. Remote, say, monitoring, remote diagnosis is already a big thing in US, not so much in other regions, but as you can imagine, I think those things will start to happen much more broadly. So scaling is going to be the thing going forward. Coming back to another element, we've seen the thing about genome sequencing. This is a very recent announcement, actually, for a startup company called Grail. And Grail got $900 million investment from venture capital, but also from, let's say, established incumbents like Johnson & Johnson, Celgene, and BMS. And why is that? Well, they believe that by bringing together computer science and data science, they will actually improve improve detection of cancer much sooner when it can still be cured. So imagine that whole market of oncology will actually become much smaller if, let's say, companies like Grail actually manage to prevent a lot of that from happening. And I think we all wish that will happen, but I'm sure that J&J, Celgene, and the BMSs of this world want to keep an eye on that part as well, because the diagnosis part will become much more important going forward. So that was actually a big thing, and according to a lot of people, that let's say that almost $1 billion investment will lead to a fast-growing health tech market this year as well. The Internet of Things, another important trend. Well, it's getting there, but pharma, life sciences, whatever you want to call it, is really not in the leading space. They're in position 8, connected health, connected industry is number 1, smart cities is number 2. So healthcare is also here, not in the leading space. The growth that's expected is relatively modest. There's growth expected, but not steep. And most of that connected health, as you can see in the red column, is actually based in US, as opposed to, for instance, smart cities, where it's much more evenly spread between Europe and US, and actually Europe is leading there. So connected health is gaining ground. A lot of great ideas, but I think a lot more can be done. It can be done in very simple things like what you see here. This is let's say, a sensor-enabled pacifier, which will alert parents if, let's say, there's something wrong with their toddler, and there's no need for the ancient artillery and instrumentarium that we used to have. So a very nice and, let's say, customer-friendly area. Closer to drugs, this is Proteus. Proteus has been around for many years, has had major investment from Novartis as well. There's no product on the market yet in terms of clinical trials approved and then FDA released, but Proteus products have real potential. And this is a great example where I believe Astellas and Children's Health use an ingestible sensor to improve adherence in adolescent transplant patients. So the sensor is released when the product has been ingested, and let's say a signal is sent to a Bluetooth-enabled device, which then, let's say, is read and sent to the connected physician. So brilliant application of this. Those patients, although they're in severe situations, they're young patients, they're really not into adherence, they don't want to take the product, and by using the Proteus sensor, adherence has improved significantly. So all of those things are great. We've seen digital first, mobile first, but when we were there in Silicon Valley and New York, it's clear that today AI, artificial intelligence, is a thing that people are really getting, let's say, totally excited about. And we talked about the future, let's say the best of times, the worst of times. Do we believe that this is the future? Do they believe that this is the future? Maybe let's say the most advanced Trekkies would, but I think we've not seen that there. I think we see a lot of AI applications, particularly in this space, where a lot of data is available, but people have never been able to use it in a very constructive and, let's say, effective way. So big data analytics is really where it can happen. And the data heap is actually increasingly growing because of the personal data that's being added to it. So all of the Fitbits, the wireless sensors, the iPhones, the iPads, and things like that, all are adding to this heap of data, which is confusing people, confusing patients, confusing physicians. So what to make of this? What to make of all these devices that patients can use and where they can actually, let's say, create reports and start discussing these things with their physicians. Their physicians are not so into that, and we need to find ways to channel that information and make it actionable. So artificial intelligence to the rescue. This is a very old example of that. It used a completely different technology. That's Deep Blue from IBM, where Kasparov was beaten by AI, but let's say an earlier version of what we see today as AI. That's 20 years ago, 1997. Today we have a much more robust and much more wide-ranging series of tools. One of them is DeepMind, acquired by Google recently, where their mission really is to fundamentally solve intelligence. So company based in UK, working closely with the NHS and some other companies in the UK. One of the issues they've had is privacy, as you would expect, but they continue working on it. And to show how strongly this field has evolved, DeepMind created AlphaGo, which is artificial intelligence that, let's say, beats, or let's say that tries to beat the best Go player in the world. And Go is apparently significantly more complex than chess. And so the world champion in Go was beaten by AlphaGo in a matter of a few iterations. So it goes really quickly, and even very complex things can be solved using the latest technologies today. This is one view of what kind of startups are active in AI. This is, of course, a temporary view. This field is evolving so quickly that it's hard to keep track of, but it gives you an idea what the promise of that is. Bring it really close to our daily lives. We also have the thing with robots, and these are two examples of robots which are used in a Belgian hospital, Pepper and Zora. And Pepper is actually a receptionist. He speaks 19 languages. He takes people from the reception to their room. He helps them with instructions and when to have lunch and things like that. So it's really helpful. And if you look very carefully, you can actually see that the robot is holding the baby's hand. So it's not seen as something unnatural. People appreciate it and like it. And if you go to the right, you see Zora there. Zora is helping in, let's say, elderly homes to really create kind of a entertainment and fitness activity, etc. And also there, at least this group looks very, very cheerful. So even that kind of things are starting to happen in healthcare, where they're supporting the healthcare personnel to actually focus on the things they do best and leave the other parts to groups like this. We talked about the elderly. This is probably one of the most important evolutions in that space, which is quite recent, but is taking the world by storm. Voice-first user interface, like Amazon Echo and Google Home, have been around for a while, but are now starting to grow significantly. And the benefit here is that you don't need a keyboard to actually instruct or to look for information, whatever. You can just talk to this. WebMD has created an app so that you can actually consult the WebMD database straight through Amazon Echo. There's also a few other players that have started coming up with adherence programs and things like that using Amazon Echo or Google Home. So the sky's the limit, and very soon a lot of homes will have this kind of, let's say, interface in place. Going back to the traditional interface, this is Boy Health. Boy Health is just out. Actually, it's a combination of physicians, a young physician, and data scientists, and they've created an algorithm which is quite intriguing, and I recommend that you have a look at it and try it for yourself. It's not a simple algorithm. It takes you through quite a few screens, not that many, but it's relatively accurate, at least in what I tried it with. So it takes you, it's a chatbot, it you through a lot of questions, and at the end it comes up with a recommendation, not a diagnosis, of course, but a recommendation, which will help a lot of people, or at least complement the type of searches they would have done without the assistance of a physician using Google, etc. So it's a really interesting, let's say, pilot, whatever. Now, we firmly believe in fusion. We firmly believe in the blend of the physical and the digital. And I think the best example, or one of the good examples that we have here is Babylon. Babylon is actually a UK-based program. Once again, artificial intelligence. They use a chatbot to, let's say, create kind of a screening questionnaire, so patients can activate the chatbot, start engaging with it, and then afterwards they're handed over to hand-picked doctors. So it's not just this, not just technical, but also there is a human interface behind it. And they believe, and it's a bit of a shocking, I think, number, but they reckon that 85% of consultations do not need to be in person. So that supports remote monitoring and things like that, but also the chatbots. And they believe that with this new approach, physicians can now spend much more time dialoguing with patients compared to only 61% in the public sector. So they believe that it will also aid efficiency and effectiveness. And I think that in that context, this is a great, I think, evolution. So this is all fantastic for these kind of kids. Our kids, the daughters and sons who use iPads, who use virtual reality, mobile phones, phenomenal. But we sometimes forget, and certainly some of the startup companies forget, that most of the target group thereafter is actually this kind of age, and they're not necessarily keen or aware of Facebook or of things like WhatsApp, as you can see here. And by the way, these are, let's say, these are all Italian examples, so it's an art done by an artist who created the blend, or the let's say the collision of the old and the new, or patients, older people tweeting here. So this is probably where a lot of people actually go wrong. Certainly the startups, where they do not see that most of the patients, or let's say the people they're targeting, are actually in the let's say the late life cycle area. And I think that this chart really brings it all nicely together. What you see here is that the use of medicine or health expenditure in general is actually has two peaks. One small peak in the early years, so between 0 and 4 baby time. Then for females, there's like another peak when they're in child bearing age, and then things start going up once patients become 65 and older. And over 90% of the $100 euro, or let's say the 100 or 90% of the healthcare expenditure is actually happening in the last 2 years. And these are typically patients, you see the pill box below there, who use multi-medications, who are not into digital, and all of those things. So a lot of digital tools have been prepared, but particularly this age group is probably the most difficult one to actually engage. So the question is, when will this change? When will we see digital natives? Will it happen 5 years from now? Will it happen 3 years from now? Will it happen 10 years from now? We all believe that it will be happening faster than today, but we should take into account that this group may not be ready for all of the tools that we're preparing for them. So the voice-aided tools like Google's Home and Alexa will certainly help. Maybe also the patients, children and things like that can help, or can play a role as well. But this, of course, is very important to take that into account. Who is your customer? So maybe that also played a role in this kind of statistic, the sobering statistic from Andreessen Horowitz, which says that every year there's about 4,000 new tech companies seeing the light of day, but only 15 of those actually make some kind of decent money. That means they're like unicorns and other big companies. Over 95% of them fail. So it's not a bright and rosy picture as sometimes it's portrayed. 95% of them fail, and in the US that's seen as a sign of let's say of courage. In Europe, still not so much the case. So why all these failures? Well, I think a lot of that has to do with what the AMA CEO said last year. He says, well, a lot of those digital health tools are like snake oil. They have been developed for a B2C environment, direct to consumer, but they actually don't know the pharma and the patients that well. So a lot of the offerings are not really well placed. Now, do they then disregard it completely? Not at all. To show their interest in the space, they created a company called Health 24/7, which is based in San Francisco, is full of physicians who actually look at the future of digital, also the impact of digital on the clinical practice in the future. So they believe in it, but what they've seen so far is not really exciting. A few other stories to illustrate that, or let's say confirm that. The days of blindly and wildly funding digital health ideas have come to pass. No one really has proved that you can make a lot of money in this sector. And I think what we all agree with, it's a very slow sector. It's a very intricate, complex sector, and people coming in from the outside really don't know what they're getting into. I think as a result of that, we now see a lot of, let's say, industry people joining startups at a very, very senior level. So the first few innings have not been great. It will not be, let's say, rosy from here onwards either. Let's say the growth will be littered with lots of, let's say, mishaps and accidents, because safety, security, compatibility, and privacy will rule. Remember the DeepMind issue around data privacy and the NHS. IBM Watson, which has been seen as one of the key players in this space, has recently had a big setback when MD Anderson, which is a leading oncology hospital chain, they actually, let's say, fired IBM Watson and stopped the program they had with them. So not everything, even the big names, are actually going to make what we think they can. And if you look at this chart, which looks at the unicorn club, unicorn is, let's say, the big market cap companies, you see that there's two which are encircled, which is Jawbone, which became a unicorn in 2011, and then Theranos, that's the other one I could spot. Maybe there's more, but I don't think so. So there's two in this space, and actually both of them are now gone. So Jawbone, I think, was acquired, at least some of it, the assets, by Fitbit, and Theranos has had to admit that its tests actually were a bit of a hoax. So it's not all gold that shines. And this one confirms that again. So this is healthcare funding for digital health. You see the drop in 2016, but you see the surge again in 2017. And I just read a report where, let's say, the global investment is supposed to be going for 10 billion. This is US, what you see here. So global should be going for 10. So that's another year of growth. So there's been a few setbacks. A lot of that has to do with the fact that the industry is complex, that the patient is not necessarily a consumer, but a very specific older type of patient who is not a digital native. But when all of these things and all of these ducks are put in a row, I'm sure this will take off in a significant way. And to compare that to financials, fintech, just added something here, stats that says that that whole industry globally in the next 3 to 5 years should be worth 150 billion. And that is probably 1/10, or let's say even 1/9 even of the total pharma industry. So this is a major industry that is growing there as well. And why would healthcare, which is one of the biggest industries, be left behind? So that question, will healthcare be left behind and will pharma be left behind, we're going to address in the next few slides. The big ones have started entering the space, as you've all have seen. These are just some of the names. Google, Apple, Samsung, Amazon, Salesforce, they all start entering the space. And sometimes they come together and form joint ventures with companies like Sanofi or GSK or J&J. In this case, this is a diabetes program with Verily, the healthcare arm of Google. Big investments, 500 million and things like that. So sometimes they partner up, but at least this whole space is seeing some renewed interest from the companies that used to play there. You may remember Microsoft with HealthFold, and Google also had a personal health record. Those things beeped and then they went down. But the fact that they're now coming back, I think shows that they have a renewed interest and have something to offer in the space. I think particularly in the prevention and the real world evidence kind of things, which are areas I think that we as an industry should be watching out for and probably want to have part of that pie as well. So what can you do about this? Well, I think today's industries, all of them, this is a slide from Peter Hinson, all of them actually look at today. So that's where the attention lies. That's the blue bar. That's 70% of our time we spend on today's issues. If we have time every year, twice, or maybe even 3 times, but sometimes only once, and even not then, we look at strategic planning. We look at tomorrow. We look at the 2 years out kind of period. And then only, let's say at the end of the year or something like that, we actually will look at the day after tomorrow. So we look very, let's say, in a very limited time towards the day after tomorrow. And if you look to the, let's say, the gray area, you actually see that tomorrow's value will, of course, come from things that will not be happening today, the day-to-day business, but really will come from new inventions, new ideas, etc. So we underspend time on the future value of our company and of our ideas, because today is really taking our attention way too much. How can you, as a company, think about those new areas where you see a lot of things happening and where you see actually also a lot of companies who, according to their shareholders, etc., are actually allowed to think and invest in that new space? Well, the rationale for doing this the day after tomorrow is there, not only because of the potential threat of those the big players, but also the small startups, but really also from a very, let's say, close focus on your day-to-day business. So if you work with health tech or digital health, you can actually improve outcomes. You can learn much more about what's happening with your product and how adherence can be improved and what kind of dosage should be taken and all of those things. It builds connection to patients as well. So the group that really has been difficult for you to engage with or at least know something about after the physician's prescription now gets, let's say, gets closer. It leads to new business opportunities. Remember the Grail effort there, 900 million from companies like J&J, etc. This is the prevention area, which is something that pharma has not gone into yet. This is a whole new space. And of course, things like beyond the pill, strengthen your branding, increase differentiation with companies who do not do this. So these are really good uses for digital health and let's say partnering up with pharma. You can read the whole article. It's from OB Health News. I recommend you read it. So there's the link there. This is very interesting and very detailed. So I'm not going to go through it, but I just want to share it with you if you want to go through it in your own time. Slide from EY, which says that major opportunities really lie in the R&D space and then in the whole patient engagement, patient experience space. And they've tried to connect a lot of those new tools and let's say technologies into those 2 areas. Suggest you have a look at it, but it shows that there's a major opportunity there. And of course, there's opportunities in manufacturing, in supply and sales and marketing, but I think we all believe that the big opportunity really lies in patient experience, prevention, monitoring, etc. So I once came across this Apple Care. Apple actually is, let's say, knows who you are, knows what you do, knows your iPhone, and it offers you a protection plan. So what do we do as pharma companies when we sell a product? Do we actually offer a protection plan to our patients or caregivers or physicians? We do not, and we lose track of that whole patient experience space. So, of course, not everything is possible from a regulatory perspective, but I'm sure with the new opportunities, much more will be possible, and maybe we'll have something called pharma care soon. There's a lot of activity here. Once again, an interesting slide from EY. We're not going to go into it, but you see a lot of companies that partner with other companies like IBM Watson, Patients Like Me, 23andMe, Propeller Health. So a lot of things are moving. If you're new to the space, you would be surprised to see what's happening, how many companies are investing in big teams, actually creating venture funds, working with other venture capital groups to really explore this. So maybe it's new to you or not, but there's certainly a lot of traction, although, as we said earlier, it's an early space, and pharma will not have an easy, I think, go at this, because pharma thinks differently, has longer, let's say, timelines, has more regulatory scrutiny and things like that. So the resistance to new ideas, the number of employees and the number of management levels clearly are different here than what you have in startups, and that a combination is not an easy one. And how do you actually engage those? Do you just invest in them? Do you actually create an incubator? Do you acquire them? How do you make that happen? Do you create a portfolio and things like that? So it's not easy, and that's really what pharma today is looking at. They're trying to find a way to create an environment where both the plantation, which is controlled, predictable, and planned, which is the day-to-day business, can really embed or partner with the rainforest, which is where the startups lie, which is serendipitous, interconnected, and organic. So how do you make those two work together without killing one or the other? I think that's the key question that pharma has today, because these companies are really different, and they bypass convention, they bypass rules. That's what they thrive on. They remove service friction, they pimp the experience, and they leverage the network. And the industry is really different. So why is it so difficult for large organizations to spot those new technologies, and why are they blind to it? Why, when they try to acquire them or embed them, do they really destroy what's in there? And then how can we make those companies really find a way to embed that rainforest? How can they become agile and really iterate quickly and, let's say, kill darlings and grow, let's say, new ideas? This is from the fintech industry, where 78% of CEOs have now endorsed fintech fully. And the question is, of course, what percentage would that be in pharma? So pharma is a bit behind, but has a lot of opportunities there as well. So to end on the, let's say, the healthcare disruption tour, this is, let's say, just a second, yeah, here we go. We went for the second time to Silicon Valley. First time was in 2015, second time was January this year. Both of them were amazing experiences. We decided to add New York to it, so we visited all of these companies, both incumbents, thought leaders, startups, accelerators, venture capitalists, hospitals, you name it, we visited them all to create a kind of holistic experience for whatever people wanted to learn from that tour. So it was a tour with about 20 people on a bus. And every day we visited 3 to 5 companies, and we were exposed to anything from artificial intelligence to app development to venture capital funding. All of those things combined really led to an amazing experience, and you can see the NPS here was 66%, so that's a great number. On a tour day, you typically visit 3 to 4 companies, go on a bus, you see them, you speak there, you listen to them, have discussions with them for 1 to 2 hours. sit on the bus, go to the next visit, have a chat, have a great dinner in the end as well, to discuss what you've learned and to probe what other people are thinking of it. So it's a very intense journey. It was intense for everybody, but as you can see, let's say the result was there, and a lot of people actually, let's say, gave us some nice quotes on that. So, and the highest ROI ever experienced was the one that's to the top left, an amazing opportunity to challenge your thinking about the future and how our roles can help influence organizations. A great way to start the year, the opportunity to engage with a diverse range of organizations and people that will generally change your perspective on the world of healthcare. So several people actually from that tour are now embarking on a journey, have set up new teams, have launched ideas, or even considering leaving their company and things like that. So it's a really engaging experience. And we'd like to continue that because things are not standing still. Things evolve quite quickly. We're going to see a lot of new companies, and the next one is actually 29th of January to the 2nd of February of 2018. So it's a similar setup. We probably will do San Francisco and Boston this time, and you'll get to see the whole range of thought leaders, incumbents, venture capital, financial startups, accelerators, etc. So it's an amazing and intense experience. And if you're interested, you can sign up for the tour or sign up to be notified of, let's say, new news about the tour. So really welcome you joining the tour. Would be great to have you on that unique experience there. And then to end very briefly, I think The Economist is, let's say, a magazine I really appreciate, and they've done a recent article about it, which is called "A Digital Revolution in Healthcare is Speeding Up." And I summarized the article for you because, let's say, this is a real good summary of the views I have as well. So they say, well, physical facilities and staff will become less and less prominent. Diagnostic and medical innovation will take their place. The evolution towards the home is there. We've seen that remote diagnosis, remote monitoring, home care evolution is big. Pharma firms, if they do not design solutions that put the patients rather than drug sales at the center of their strategy, they risk losing relevance. So the interest is there from the pharma industry. I think the interest is justified, and probably should be growing as well. And last but not least, more data will not only identify those drugs that do not work, that's a very low-hanging fruit, but digital health will also give rise to new services that might involve taking no drugs at all. And last but not least, this will particularly benefit the patient. So the patient experience going forward will, thanks to health tech, thanks to digital health, will improve. And whether pharma or other healthcare players benefit from it, I think will be very much up to them. And if after this presentation you still feel confident, I want you to look at this quote from Woody Allen, who says, "Confidence is what you have before you really understand the problem." So I hope I've given you some light into some of the key trends, some of the opportunities, some of the early issues as well, and hopefully this has given you some food for thought. And feel free to let me know what kind of ideas you have on this. And if you want to join the next tour, be more than welcome to join up, and look forward to seeing you. So thank you for your time. Do apologize for today's hiccup, but thank you, and have a great evening. Thank you. Bye.